Newsday continues here on One News Now. I'm Charles Lejano. Manila Mayor Isko Moreno visits unfamiliar territory as they take their campaign to La Union. Romel Lopez is live on the ground to tell us more about this. Romel, good afternoon. How was the reception for Mayor Isko?
Yes, Charles, you're right. It's a new campaign battleground here in La Union for Team Isko. But the Manila Mayor has been insistent on wanting to reach as many supporters as possible. Charles, it is evident during Action Democraticos motorcade today that they are in an unfamiliar territory. Supporters and well-wishers for Moreno and his team were not that many compared to other places they have visited. We asked some residents and the answer was clear that Ilocano will support an Ilocano candidate. Despite this, Moreno hopes he can be an alternative choice for some. The mayor also visited Governor Francisco Ortega III of La Union. Moreno says he's happy that their team is welcome in the area. He promised agricultural reform for the region and assured Ilocanos that smuggling has no place should he win the May polls. Moreno cited smuggling as one of the reasons why agriculture has been lagging in the area. Charles Moreno is scheduled to finish his motorcade in the province today. Tomorrow, his team will go around Pangasinan and in Central Luzon, especially Interlac. Over the weekend, a stronghold of the Liberal Party. Charles?
Thanks for that, Romel. That was Romel Lopez reporting live from La Union. A panelist from the SMNI presidential debate clarifies that they did not provide questions in advance to candidates. UP Political Science Professor Clarita Carlos told 1PH's Sa Totoo Lang that the network gave in to her request not to provide questions in advance. Carlos said the organizers were asking for copies of her questions to prevent similar inquiries among the panelists.
There was discussion about the format. Sabi nung isang taga-network, siguro kailangan lahat ng questions ng panelists i-submit para hindi kayo magduduplicate, mag-overlap, etc. I immediately objected. Sabi ko, no way are we going to give advanced questions.
Yeah. In COVID news, the Health Department reports over 2,100 new COVID-19 cases on Thursday. This has brought total infections to 3,646,000. Some 66,500 of which are still considered active. 107 new COVID-related deaths were also recorded, pushing the death toll to over 55,300. Total recoveries have now reached 3,524,000, with 4,400 new survivors logged over the past 24 hours. Out of the 29,300 tests conducted, around 9.7% turned out positive. A recent study in the United States flags the long-term effects of COVID-19. These include mental health problems up to a year after the infection. The details in this Bloomberg video.
The diseases that we're talking about right now as a result of COVID-19 in the long term are chronic diseases that really will scar people for a lifetime. Specifically, the mental health disorders we see across the board: anxiety, depression, we see sleep problem, neurocognitive decline, opioid use disorders. It's really across the board. Even people who did not get hospitalized are also exhibiting increased risk of mental health disorders. So that's really also important, because that's really the majority of people with COVID-19 in the US, in Australia, in the UK, globally. And we definitely need to pay attention to the acute effects of COVID, but really we also need to start shifting our framework a little bit of mind and prepare for the aftermath of all of this. the virus that's causing this pandemic, SARS-CoV-2, is actually now capable of producing long-term consequences on a scale that we have never seen before in mental health disorders and also other disorders. And we've seen cardiovascular disease and other disorders. It produces a myriad abnormalities that will stick with people for a lifetime and have really long-term ramifications on their ability to rejoin the workforce, be able to contribute to economy and the quality of life, and also arguably life expectancy. Maybe, COVID will become endemic, but there are millions of people around the world with mental health problems, with heart problems, with kidney problems, as a result of COVID. Those people will need care for decades. And I think that public health authorities in governments and health systems around the world should really start paying attention before it's too late to the aftermath of the pandemic, to the long-term consequences that the pandemic is causing.
Here's a quick look at today's other top stories. The Octa Research Group is flagging a so-called Valentine's Day case spike in Metro Manila. This after the capital region tallied more than 600 new cases on Wednesday, exceeding the group's earlier projections. The Octa Research Group had earlier projected less than 500 daily infections in the NCR by Valentine's Day. The National Water Resources Board says the Angat Dam may reach minimum operating level of 180 meters by late April or early May. The agency says deep wells and water treatment facilities are being prepared to help with the expected low water supply. And Gilas Pilipinas has started training for the FIBA World Cup Asian qualifiers scheduled later this month. But the team faces a setback after Jason Castro hurt his shoulder in the game last night versus San Miguel. It is not yet clear whether he can play once the qualifiers begin on February 24. For more updates, visit News 5, the Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. And you can also catch One News on Signal Play. Just register for a free account at www.signalplay.com so you can stream One News live anytime and anywhere. Mask on, wash hands, and stay safe, Philippines. I'm Charles Lejano. We're One News.